Scoliosis treatment without surgery, is that possible? Well, I'm going to share a case with you, so stay tuned. Hey, I'm Dr. Ekberg with Wellness for Life, and if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that you don't miss anything. So what is scoliosis? Well, the human spine is supposed to have certain curves. So if you look at it sideways, then it's supposed to have an S curve. But if you look at it from the front, it's supposed to be perfectly straight. So if you look at it from the front and it has a sideways curve, that's not a good thing, and that's called scoliosis. And how does scoliosis develop? Well, think of it like a tree. That if you have a young tree that's very flexible, very soft, and you attach a string to one end of the tree and you pull it down to the ground, then you create a bend in that tree. And if you leave the string there, the tree will continue to grow, but because there's a force applied, then it will be forced to stay in that position and it will grow in that shape. The spine is the same way. The body is very intelligent, so it will grow. Bone will grow along lines of stress, along lines of force and weight bearing. So gravity is always pulling on the body, so if that's the only factor, then you'll grow straight. But in the body we also have muscles, and on both sides of the spine there are muscles. And if one side has more muscle tension, then it's going to pull the spine, it's going to curve the spine in that direction. And in the body, muscles don't work by themselves, they do only what the brain tells them to do. And if the brain tells them to pull differently, it's because the brain is confused. The brain only knows what it's being told by your senses and by receptors and by signal pathways. So the brain receives all this information and it does its very best to create a true picture, to interpret what reality looks like. But if the world looks like this and the brain is told it looks like that, the brain is going to create an imbalance. And it is sort of on purpose. It is intelligent, but it's based on the fact that it's got bad information. It's doing the best it can with that information. So if we have unequal tension on the two sides of the spine, then that feedback has been interfered with. There's something distorting that information. And we know in chiropractic that there is chemical stress, there is structural stress, and there is emotional stress. So any combination of these factors of emotional stress or physical trauma or accidents or slips and falls or food allergies, chemicals, metals, etc., etc., etc. Any of these things can distort information and give the brain an untrue picture of what the world looks like, and now the brain can't get the job done perfectly. So bone is a little different depending on if you're still growing or if you have stopped growing. While you're still growing, all the bones have what's called a growth plate. And that growth plate is kind of flexible. It's still cartilage. It's not solidified all the way. So while you're still growing, there is time to change the curve. There's time to change what that looks like. And then sometime in the late teens, when you stop growing, then those growth plates fuse and that bone is pretty much set. So we don't know for sure if that is an absolutely set, but we can know for sure that it is very, very difficult to change the shape after that age. So let me tell you about a lady that came in not long ago. She had been to chiropractors, they took pictures, and her scoliosis was so severe they wouldn't even touch her. They said, no, we don't want to hurt you. She went to the orthopedic surgeons and they said, oh, well, your terrible pain is because of this terrible curve, and the only option that you have is surgery. If we put some rods in, we can kind of brace your body, your spine, and keep it from getting worse. We don't know if the pain is going to improve. So fortunately, she came into our office and we explained how things worked. I said, I don't think I can change your scoliosis, but maybe I can change your quality of life. 2 weeks later, she's completely pain-free. She's living a normal life. She's moving, she's bending, she's doing all her normal things. So did I fix her scoliosis? Of course not. That's been taking decades to develop, and if at all, it's not going to change very quickly. Did we change a couple of degrees? Possibly. But what we did do, we have to understand that this developed because of a functional problem. There was an imbalance in the perception that caused this problem. So what we did is we improved the perception. We allowed the brain to get a truer picture. We allowed the brain better control and understanding of the muscles. So the reason that the spine bent was that there was more force on one side and less force on the other. And where the side where there was less force means that wasn't working enough. So by helping the brain improve the function on that side, we helped create a functional balance. We helped the brain work with what was there. Are we ever going to change that scoliosis? Maybe a few degrees, probably not much. She was somewhere between 50 and 60 years old, but what we did do is we changed function. We changed her quality of life. Understand that just because an X-ray or an MRI or a diagnostic test says that it is so, and that is the cause, that doesn't make it so. What shows up on the X-ray or the test is a result of a functional problem. If we can change the function, we can improve the quality of life. Remember that the body is designed to heal. If we work with the body, if we support it, if we help it, then it can get better. If we interfere with it, if we take medication, if we try to force it to do certain things, that is not going to help it work better. Hope you enjoyed this information. If you have experiences about scoliosis, if you know someone with scoliosis, if you have questions, please make some comments and let me know. I'll do my very best to respond and answer. And if you're new to this channel and you enjoy understanding how the body really works, then make sure that you subscribe and hit that notification bell so that we can keep this content coming your way. Thank you so much for watching.